So I came to NC State in 2006 and started my nutrition degree, and I graduated in December of 2010. After I graduated in 2010, I became a nurse assistant and worked at a family practice in Raleigh, Family Medical Associates. And with there, I worked for about 2 years before I went to PA school in August of 2013. I'm a physician assistant at UNC Hospital in the GI surgery division. So in order to be a physician assistant, you have to have a bachelor's degree, which I got here at NC State, and then you have an additional master's degree in physician assistant studies. For the first 18 months of PA school, it's all stuff in school, so it's called our didactic year. So we are in school, we pretty much take anywhere from 14 to 18 credit hours worth of school, and it's straight through. So from August until the next December, you're in class. And then the last year, you are in clinical rotation. So you're there for 4 weeks at a certain site. You rotate family medicine, internal medicine, pediatrics, electives, and they're one after the other. So pretty much you have 12 new jobs within that year. You're starting at a new place and learning. So that's where you get your hands-on experience. Okay, so a typical day, we round in the morning at 6 o'clock, so I usually show up around 5:30 or so and pre-round on patients. We have our census list, so patients that are admitted either for surgery or they're admitted for further management, continuation of care. We check up on them, we round. We go over the patients with our surgeon in the morning before they go to the operating room or before they see patients in clinic. And pretty much what I do is do the notes for all the patients on the floor and kind of manage anything that happens acutely. So any type of pertinent pages that come through about medications, call for consults, go down and see different wounds and kind of do assessments and manage things on the floor while the surgeon and the residents are down in the operating room or in clinic. I use nutrition every day. So especially with GI surgery, we have a bunch of patients who have Crohn's disease, ulcerative colitis. They have different GI issues where they have short gut from having multiple surgeries, and different nutrients are absorbed in different areas of the GI tract. So a patient has ulcerative colitis and now has no colon. It's a whole issue right there. Or if they have other diseases where they've had to have multiple resections and they have short gut, we weigh whether they need to be TPN dependent or not. So TPN is total parenteral nutrition, and so what they do is they get all of their nutrition through an IV. They get this, it's a huge, we call it a formula. So they have this massive formula where the nutritionist and the pharmacist make sure that they're getting the adequate amount of protein, carbohydrates, fat, essentially everything essentially that you need that you would get through food, but they get it through IV. They get this because they're not able to absorb things in their GI tract. It's altered for some reason. We have an amazing staff that we work with pretty directly at UNC. The pharmacy team and the dietitians work together. They come up with the TPN formulas. They make sure that everything is correct when it comes to nutrition balance. They do metabolic carts, things like that, and we're in contact with them every day. We have two or three that are primarily just for the GI team that focus on our patients, our specialty. They know what kind of medications these patients use, which things kind of help with absorption, which things don't. Initiating TPN, doing TPN teaching. So a lot of what we do sounds like I'm talking a lot about TPN, but that's kind of the far spectrum of things for patients who need that enteral nutrition. But between the TPN and patients just knowing their general anatomy and kind of figuring out what's best for them in regards to their nutrition, we deal with it every day. After graduation from NC State, I realized that my learning wasn't done. I love nutrition. We had a fantastic staff here at NC State that I learned from, but I realized that whether I wanted to do medicine or whether I wanted to go into nutrition, there's so much more to learn. And so for me, I knew that my path wasn't finished. So yeah. Finishing PA school. It was very hard. It was one of the hardest things I had to do just because it's essentially 4 years of medical school condensed. We have a similar curriculum as medical students do. And it was very challenging, but it was also very rewarding because you learn about these disease processes in books. You see pictures of things, and then when you actually have a patient that sits in front of you and says, I have this disease, how can you help me? It's pretty rewarding to know that you're taking care of them and you have their best interest and you know that you're going to do the best job you can to make them feel better. have done anything differently actually. With going to NC State and graduating in December, I started my job as a nurse assistant that June, and I worked for about 2 years before PA school started. And working and seeing how, everything that I learned at NC State and everything that I had yet to learn, I got full exposure to that before I started school. And I think that's really important too. I wasn't the traditional PA student where I went to undergrad and went right into graduate school afterwards. And I think taking time, learning, being around other physicians, making sure that medicine was something that I wanted to do was really important. So I think it's important to understand why. It's easy to memorize information and pour it back out on a test and do things like that, but really understanding why something is the way it is, how it is, why this is important as opposed to this, or things like that is really going to be helpful. It's more of that applied learning. My biggest recommendation is memorizing and understanding the basics, and then being able to apply that and ask why.